Good morning. My name is Noor. I am a nursing officer actually posted at the Valley Depot Community Healthcare Center, and today we have Mrs. Noemi with us. Good morning, Mrs. Noemi.
Good morning, Mr.
Please tell us about yourself.
I'm Noemi, I'm 35 years old and I'm actually type 2 diabetes patient and already on insulin. But actually I got some pain because I do my insulin only on my arms, and I have heard about novel insulin, so I wanted to know more about it, please.
Okay. Thank you. Please have a seat.
Thank you.
Today I will be teaching Mrs. Naomi how to go for subcut insulin injection around the navel. First of all, you already know about the requisites we will be needing. So we go directly. You already know about the precautions you have to take while injecting and all this. You know that whenever you need to inject insulin, it should be at room temperature. So if it is stored in the refrigerator, you need to remove it from the refrigerator 30 minutes or from the cooler bag 30 minutes before injection.
Okay.
Then you go for it. Once it is open, it may be stored at room temperature for 28 days. Okay. For your requisites, you will need the syringe, the insulin vial, some cotton with alcohol swab, and a gallipot to discard the used alcohol swab, and a sharp container to discard the syringe and the needles along. Alright, so before starting, you always wash your hands, ensure it is clean, and sanitize your hand. Alright, you ensure it is the prescribed drug and all this. You gently roll it around your hands, never shake or it will clump.
Okay.
Alright, once it is clumped, you cannot use it and you have to throw it away.
Okay.
Alright, you go for it, you take the needle, the syringe, you pull back the plunger. You pull back the plunger to how much you need to inject. Then you gently remove the cap.
Okay.
Then at 90 degrees you insert it into the rubber cap. Before inserting, you need to be sure that it is clean. If it is not covered by the plastic cap, you need to wipe it with an alcohol swab. Then you inject it at 90 degrees into the vial. Then you invert it. You push the air gently inside, and then you pull back to the required dose you need to inject. Now you will see that on the first time there will be air bubbles. You gently tap the syringe and push back. Push back so the air flows back into the vial. Then you pull back on the plunger. So you have the required dose you need to inject. Then you remove it, and for the site of injection, you will see you have to, around the navel, you have to keep 2 inches, that is around 5 centimeters around the navel. Alright? Around the navel, once you insert the site, you pinch the skin and you insert the needle at 45 degrees to the skin, and then you push. Alright? You leave it for 5 seconds, then you remove. Alright, now when you will have to regular doses, you need to keep 1 inch around the 2 inches around the navel, but 1 inch from each of the spots. So you have to keep rotating the site to prevent necrosis and other infections of the skin. Alright, when giving yourself the shot, you have to ensure that the skin is clean. It is visibly clean. Alright, never swab alcohol on the spot side. Okay? Do you have any question?
No, just so you have to you have to rotate it.
Yes.
Okay, that's why I
You have to keep 2 inches around the navel,
yeah,
but 1 inch
in between
the sides.
Okay.
Alright, after it is finished, you discard the used syringe and the needle into the shop container.
Okay.
Alright, any doubts about it?
No, it's okay. So I usually do my insulin but this time on the navel, so I have just 5 centimeters away from my navel, and I
Yes.
have to rotate it.
You rotate
Okay,
it
it's very easy.
2.5 centimeters from each spot.
Okay, yeah, I
Okay.
understand now.
Thank you for your attention.
Thank you to you.
Thank you.